Urologist's warning. 4 common medications silently wrecking your sex life after 60. Alternatives inside. You know, friends, one of the things I cherish most about sitting down with folks in our season of life is the honesty. We've lived a bit, learned a lot, and we value what truly matters: connection, companionship, and yes, that spark of intimacy that makes life feel vibrant. But sometimes, quietly, something starts to dim that spark. Maybe you've noticed it yourself. A lack of desire that wasn't there before, difficulties getting or keeping an erection that feel frustratingly new, or just feeling less connected to that part of yourself. It's easy to chalk it up to just getting older, isn't it? To shrug it off as inevitable. But what if I told you that very often, it's not just age? What if the culprit might be something sitting right in your medicine cabinet? Hi, I'm Dr. Samson Palmer, and I've been a urologist specializing in men's health for over 25 years. In that time, I've seen countless men over 60 walk into my office feeling defeated, believing their sex life is simply fading away because of their age. And so often, after talking, after looking at their health, and crucially, after looking at the medications they take every single day, we find a different story. We find specific, common prescriptions, medications taken for very important reasons that are silently, unintentionally, throwing a wrench into their intimate lives. The frustrating part? Many doctors, focused tightly on the condition the medication treats, might not always bring up this potential side effect proactively, and many men feel too embarrassed to ask. Now please, hear me loud and clear. This isn't about blaming anyone or telling you to stop vital medications cold turkey. Absolutely not. Your heart health, your blood pressure, managing pain or mood, these are crucial. But knowledge is power, my friends. When you understand what might be happening, you can have a different kind of conversation with your doctor. A conversation focused not just on treating one problem, but on treating you, the whole person, and finding solutions that support your overall well-being, including that important part of your life and relationships. That's exactly what we're going to talk about today. And over the next little while, we're going to uncover 4 of the most common types of medications prescribed to folks over 60 that can significantly impact sexual function, desire, arousal, erections, the whole picture. And more importantly, for each one, we'll explore potential alternatives or adjustments that you can discuss with your own doctor. Realistic options to help you reclaim that vitality without compromising your essential health. Think of this as getting your toolkit ready for a better conversation with your physician. So, let's start with one that touches so many lives, especially as we navigate life's complexities. Medications for depression and anxiety. Now, mental well-being is absolutely foundational. Feeling low, anxious, or overwhelmed takes a huge toll on every aspect of life, intimacy included. Getting help, often through medication, is vital and courageous. Common medications here are the SSRIs, names you might recognize like sertraline Zoloft, paroxetine, Paxil, fluoxetine, Prozac, and escitalopram, Lexapro, and SNRIs like duloxetine, Cymbalta, or venlafaxine Effexor. These work by adjusting important brain chemicals like serotonin and norepinephrine. The challenge, while they do wonders for mood, a very common side effect profile for many of these medications includes, well, dampening the sexual spark. We're talking about a significant decrease in libido. That drive just isn't there like it used to be. Difficulty achieving orgasm, or orgasms that feel less intense or satisfying. And for many men, they can contribute directly to erectile dysfunction, trouble getting or maintaining an erection. It's a cruel irony, isn't it? You take medication to feel better, to engage more with life, and it inadvertently puts a roadblock in one of life's most intimate connections. The effect can be quite pronounced and deeply frustrating. But here's the hope, and why bringing this up with your doctor is so important. This doesn't mean you have to choose between stable mood and a satisfying sex life. Not at all. Psychiatry and urology have made strides here. The key is collaboration. Urologist, first, timing matters. Sometimes, simply taking your SSRI or SNRI at a different time of day, maybe earlier, giving it time to metabolize before evening intimacy, can make a subtle but noticeable difference for some men. It's a simple tweak worth discussing. Second, dose adjustment. If you're stable on your medication, your doctor might explore if a slightly lower dose could still effectively manage your mood symptoms while lessening the sexual side effects. This needs careful monitoring, of course, but it's a valid path. Third, and this is a big one, medication switching. Not all antidepressants affect sexual function equally. Bupropion, Wellbutrin, for example, which works on dopamine and norepinephrine differently, is often associated with much lower rates of sexual side effects and can sometimes even boost libido. It might be an option, especially if depression involves low energy or lack of motivation. Mirtazapine, Remeron, is another often considered to have a more favorable profile in this regard. Switching isn't always straightforward and depends entirely on your individual health history and needs, but it's a crucial conversation to have if sexual side effects are bothering you. Fourth, strategic addition. In some cases, especially if switching isn't ideal, your doctor might consider adding a medication specifically to counteract the sexual side effect. This could be a low dose of bupropion alongside your current antidepressant, or sometimes medications like buspirone, Buspir, have shown some benefit. There's also research into adding certain supplements, but always discuss these with your doctor first to avoid interactions. And finally, never underestimate non-medication approaches. Continuing or starting therapy, like CBT, cognitive behavioral therapy, can be incredibly powerful for managing depression and anxiety, potentially allowing for lower medication doses or even, in some cases, tapering off under supervision. Lifestyle changes like regular exercise, good sleep, and stress management techniques are potent mood boosters too. The message here isn't fear, it's empowerment. If you're on medication for mood and feeling like your intimate life has taken an unexplained hit, don't suffer in silence or assume it's just age. Bring it up with your doctor or psychiatrist. Say, "Doctor, I appreciate how this medication helps my mood, but I've noticed it's really affecting my interest in sex and my ability to perform. Are there adjustments we could explore?" Frame it as wanting the best overall quality of life. You deserve both mental peace and physical connection. Now, while mood medications are a major player, they're certainly not the only common prescription that can quietly interfere. Another one, affecting millions managing blood pressure or prostate issues, involves a class of medications working on something called alpha receptors. And understanding how those work and what alternatives might exist is our next important step, because tackling high blood pressure or an enlarged prostate shouldn't mean sacrificing intimacy either. So, we talked about how important it is to address the impact mood medications can sometimes have, and the hopeful paths forward through conversation with your doctor. It's about finding that balance, isn't it? Well-being for your mind and your body. Now, let's turn our attention to another incredibly common category of medications, one that many of you watching are likely familiar with. Medications for blood pressure and prostate health, specifically those known as alpha blockers. Think about it. High blood pressure, hypertension, affects so many of us as we get older. It's silent, it's serious, and managing it is absolutely non-negotiable for a long, healthy life. Then there's the prostate, benign prostatic hyperplasia, or BPH, that annoying, often nightly struggle with frequent urination, a weak stream, feeling like you just can't quite empty your bladder. It's incredibly common in men over 60. Alpha blockers, medications like terazosin, Hytrin, doxazosin, Cardura, and tamsulosin, Flomax, are often prescribed for both of these conditions. They work by relaxing certain muscles in blood vessel walls to lower pressure, and around the prostate and bladder neck to ease urine flow. For many men, they provide real, tangible relief from those frustrating urinary symptoms. But here's the silent impact, the part that often doesn't get discussed as openly as it should. What these medications do down there. Alpha blockers work by blocking specific receptors, called alpha receptors. The problem is, these same receptors play a crucial role in the intricate process of getting and keeping an erection. You see, an erection isn't just about desire. It's a complex hydraulic event. When those alpha receptors are blocked, the signal that normally tells certain muscles to relax and allow blood to flow into the penis can get muffled. The result? For a significant number of men, alpha blockers can lead to difficulty achieving an erection, erectile dysfunction or ED, or trouble maintaining one firm enough for satisfying sex. Sometimes it can even lead to a condition called retrograde ejaculation, where semen goes backwards into the bladder instead of out. It's not harmful, but it can feel strange and disappointing. It feels like another unfair trade-off, doesn't it? You take medication to protect your heart or finally get a decent night's sleep without constant bathroom trips, and it throws a curveball at your intimate life. Men often tell me they feel stuck. Choose between a healthy heart and a fulfilling connection, or between a peaceful night and a satisfying relationship. But friends, just like with the antidepressants, this isn't an either-or situation. We have options, strategies, and room for conversation. Let's break down what you can discuss with your doctor. The which one conversation. Not all alpha blockers are created equal when it comes to this side effect. Tamsulosin, Flomax, and alfuzosin, urixatrol, are what we call uroselective alpha blockers. They were designed to target the receptors in the prostate and bladder neck more specifically, while having less impact on the receptors involved in erections. For many men experiencing ED or ejaculation issues on older alpha blockers like terazosin or doxazosin, switching to tamsulosin or alfuzosin can make a world of difference, often significantly reducing or even eliminating those sexual side effects, while still effectively managing those urinary symptoms. This is often the very first switch we explore. The one strategy for blood pressure if you're taking an alpha blocker primarily for high blood pressure and not for BPH. This opens up a wider field of alternatives. There are many other excellent classes of blood pressure medications, like ACE inhibitors, lisinopril, enalapril, ARBs, losartan, valsartan, calcium channel blockers, amlodipine, or certain diuretics that generally have much lower rates of sexual side effects. Your doctor can help determine if switching to one of these is safe and effective for your specific heart health needs. It might be a very straightforward solution. Combination therapy. For BPH, if you need strong relief for BPH and tamsulosin/alfuzosin isn't quite cutting it for your urinary symptoms on its own, or if you tried it and still had sexual side effects, don't despair. We have other excellent medications for BPH, like 5-alpha reductase inhibitors, finasteride, dutasteride. These work differently, by actually shrinking the prostate over time. Sometimes, using a lower dose of an alpha blocker, combined with one of these 5-alpha reductase inhibitors, provides the urinary relief you need with fewer sexual side effects than the higher dose of the alpha blocker alone. It's about finding the right mix. Addressing ED concurrently. If managing your blood pressure or prostate absolutely requires an alpha blocker that's causing ED, and switching isn't ideal right now, the ED itself is treatable. Medications like sildenafil Viagra, tadalafil Cialis, or vardenafil Levitra work through a different pathway and are often safe and effective even if you're on an alpha blocker. Crucially, you must discuss this with your doctor first. They need to check for potential interactions, especially with blood pressure meds, and ensure it's safe for your heart. Never just get these online or from a friend without medical supervision, but under a doctor's care. They can be a powerful tool to counteract the ED side effect while you stay on your essential medication. I remember a patient, let's call him Walter. Sharp as a tack, 72. Came in almost sheepish. His cardiologist had him on doxazosin for his blood pressure. It was working well, but Walter confessed, quietly, that things just weren't working downstairs since he started it, and it was causing strain with his wife of 45 years. He felt guilty even bringing it up, like he was being vain. We talked about his options. We switched him to an ARB for his blood pressure, which controlled it just as well. Within a few weeks, Walter was back in my office, this time with a twinkle in his eye and a quiet thank you document. His wife sent me a thank you card. That conversation, that willingness to speak up, restored something vital for him. Walter's story is so common and so fixable. If you're on an alpha blocker, whether for blood pressure or your prostate, and you've noticed a change in your sexual function, please, don't assume it's just age or that you have to live with it. Schedule a chat with your doctor or urologist. You can say, "Doctor, this medication is helping my blood pressure/prostate, but I've noticed it's making it much harder to get or keep an erection. Are there other options we could consider that might be easier in that department? Be specific about the change you've noticed. Your doctor wants to know this. Protecting your heart and your prostate shouldn't mean sacrificing intimacy. Now, alpha blockers are a key player, but they aren't the only blood pressure medications that can sometimes whisper trouble into your intimate life. Another very common class, often working alongside others, involves medications that affect your heart rate and rhythm. The beta blockers. Names like metoprolol, atenolol, propranolol, carvedilol, they're workhorses for managing blood pressure, angina, and protecting the heart after certain events. And just like the others, while they're doing their vital job, they can sometimes cast an unintended shadow on sexual vitality. Understanding how and what to do about it is where we're heading next. We talked about alpha blockers and how vital it is to have that conversation if they're dimming your intimate spark while managing blood pressure or prostate issues. Now, let's move to another pillar of heart health medication, one that millions rely on: beta blockers. Names like metoprolol, atenolol, propranolol, carvedilol. These are truly life-saving medications for many. They slow the heart rate, lower blood pressure, manage angina, chest pain, and protect the heart after events like a heart attack. Their importance cannot be overstated. But here's the quiet reality, the one that often gets overshadowed by their crucial cardiac benefits. Beta blockers can sometimes put a damper on sexual function. How? It's partly about blood flow, just like with alpha blockers, but also about the nervous system signals. Beta blockers work by blocking the effects of adrenaline and noradrenaline, those fight or flight hormones. This is fantastic for calming an overworked heart. However, the very same system plays a key role in sexual arousal and response. Blocking those beta receptors can lead to decreased libido. That initial spark of desire might feel muted, harder to find. Erectile dysfunction, ED, difficulty achieving or maintaining an erection, becomes more common. They can cause vasoconstriction, narrowing of blood vessels, making it harder for the necessary blood flow to reach the penis. They can also dampen the nervous system signals needed to trigger an erection. Ejaculation issues. Some men report delayed ejaculation or less intense orgasms. It feels like walking a tightrope, doesn't it? Protecting your heart, your very life, while wanting to feel fully alive, connected, and vital in your relationships. You shouldn't have to sacrifice one for the other. The good news is, just like with the other medications we've discussed, there are pathways forward, options to explore with your doctor. So, what can you discuss at your next appointment? The which beta blocker? Question. Not all beta blockers impact sexual function equally. Some of the older, non-selective types, like propranolol, tend to have a higher incidence of these side effects. Newer, more cardioselective beta blockers like nebivolol biastolic are designed to target the heart more specifically. Interestingly, nebivolol also has a unique ability to promote vasodilation, widening of blood vessels, through a different mechanism, which counteracts the usual vasoconstrictive effect of beta blockers. For many men, switching to nebivolol significantly reduces or even eliminates sexual side effects while still providing excellent heart protection. It's often the first alternative we consider. Dose adjustment. If you're stable on your current beta blocker and the dose is on the higher end, a carefully monitored reduction might lessen sexual side effects while still controlling your heart condition effectively. This is not something to try on your own, but a valid discussion point with your cardiologist. Alternative heart meds. If beta blockers are causing significant problems and nebivolol isn't suitable, remember there are other powerful classes of blood pressure and heart medications. ARBs, losartan, valsartan, etc., and long-acting calcium channel blockers, amlodipine, etc., generally have very low rates of sexual side effects and might be excellent alternatives or additions to your regimen. Your cardiologist can assess what's best for your specific heart health needs. Concurrent ED treatment. If your heart condition absolutely requires a specific beta blocker and switching isn't feasible, medications like PDE5 inhibitors, sildenafil/Viagra, tadalafil/Cialis, can often still be safely used to treat the ED under strict medical supervision. This is absolutely critical. You must discuss this with your cardiologist first. They need to ensure your heart is stable enough for these medications and check for potential interactions. Never combine them without expert guidance. I recall a gentleman, let's call him Frank, a vibrant 68-year-old who loved woodworking. After a minor heart scare, his doctor started him on a standard beta blocker. His blood pressure came down beautifully, but Frank confided that his energy for his workshop and the bedroom had plummeted. He felt sluggish and, frankly, a bit defeated. He assumed it was just part of getting old after the heart issue. We talked about nebivolol. His cardiologist agreed to switch him. Within a month, Frank was back, not just with better blood pressure readings, but with a renewed twinkle. "Doc," he said, grinning, "the sawdust is flying again, and so is, well, you know." That simple switch gave him back a core part of his vitality. Frank's story reminds us that these side effects aren't trivial. They affect quality of life, relationships, and how we feel about ourselves. If you're on a beta blocker and noticing changes in your sexual desire or function, please don't dismiss it. Talk to your cardiologist or primary care doctor. You can say, "Doctor, I know this beta blocker is important for my heart, but I've noticed it seems to be affecting my interest in sex and my ability to get/maintain an erection. Are there other options within this class, or different types of heart medication that might be easier on that aspect for me?" Frame it as optimizing your overall health and well-being. A healthy heart deserves a vibrant life around it. Now we've covered medications for mood, blood pressure, prostate, and the heart. But there's another incredibly common type of medication, often used daily by folks our age for everyday aches and pains, that can also have a subtle, under-the-radar impact. Common over-the-counter and prescription pain relievers, specifically NSAIDs. NSAIDs, nonsteroidal anti-inflammatory drugs, are household names. Ibuprofen, Advil, Motrin, naproxen, Aleve, and prescription ones like celecoxib, Celebrex, or diclofenac, Voltaren. They're fantastic for reducing inflammation, easing arthritis pain, soothing headaches, and managing muscle aches. For many, they're essential for staying active and comfortable. But their mechanism of action, blocking enzymes called COX-1 and COX-2, which produce prostaglandins involved in pain and inflammation, can also interfere with processes crucial for sexual function. How? Prostaglandins aren't just about pain. They also play a role in regulating blood flow and even nerve signaling involved in arousal and erections. Chronic, high-dose use of NSAIDs can potentially reduce libido. Some studies suggest a link between long-term NSAID use and lower testosterone levels in men, though the evidence isn't entirely conclusive and likely varies by individual and specific. NSAID contribute to erectile dysfunction by potentially impairing blood vessel dilation and affecting prostaglandins needed for healthy erectile tissue function. This effect seems more pronounced with frequent, long-term use rather than occasional doses. Cause general fatigue/malaise. Constant pain and the side effects of NSAIDs, like stomach upset, can indirectly lower energy and desire. Now, this doesn't mean you should suffer in pain. Managing discomfort is vital for quality of life. But it does mean being mindful, especially if you're taking NSAIDs regularly, and noticing a dip in your sexual vitality. Here's what to consider and discuss. Frequency and dose. Are you taking them every single day? Could you manage with a lower dose, or use them only when pain is truly significant? Reducing chronic exposure can help minimize potential impacts. Topical options. For localized pain, like knee or hand arthritis. Topical NSAIDs, gels, creams, patches like Voltaren gel, Pensaid, Flector patches, are excellent alternatives. They deliver relief right where it's needed with minimal absorption into the bloodstream, drastically reducing the risk of systemic side effects, including potential impacts on sexual function. Alternative pain relievers. Acetaminophen, Tylenol, works differently than NSAIDs and generally doesn't carry the same potential risks for sexual function or cardiovascular/kidney issues, though it has its own limits regarding liver safety at high doses. For certain types of nerve pain or chronic conditions, other classes of medications, like specific antidepressants or anticonvulsants, might be more appropriate and have different side effect profiles. Discuss this with your doctor. Non-medication approaches. This is huge. Physical therapy, gentle exercise, like swimming or Tai Chi, heat/cold therapy, weight management, and even mindfulness or acupuncture can be incredibly effective for managing chronic pain and reducing reliance on daily NSAIDs. Investing in these approaches supports your whole body health, including your intimate life. Natural anti-inflammatories. Discuss incorporating foods rich in omega-3s, fatty fish, turmeric/curcumin, with piperine for absorption, and ginger with your doctor. While not replacements for prescribed meds, they can support an anti-inflammatory lifestyle. The key is awareness and balance. If you rely heavily on NSAIDs for pain management and feel your sexual health is suffering, talk to your doctor about a pain management strategy review. Explore if topicals, acetaminophen, non-drug therapies, or a combination could offer relief with fewer downstream effects. You deserve comfort and connection. We've journeyed through some of the most common medication categories that can silently influence your sexual wellness after 60. Mood helpers, blood pressure and prostate meds, heart protectors, and pain relievers. Understanding these connections is the first, powerful step. But there's one more crucial piece to this puzzle, a type of medication so widely used, often considered very safe, yet it holds another potential key to unlocking, or inadvertently locking down, that vital spark. In our final part, we'll uncover this last common culprit and, most importantly, weave together all we've learned into a practical plan for reclaiming intimacy and having truly empowered conversations with your healthcare team. Because your golden years should shine brightly in every way. We've walked through some important territory together, haven't we? From the quiet impact of mood medications to the blood flow challenges with alpha blockers and beta blockers for heart and prostate, and even the subtle influence of everyday pain relievers. Understanding these connections, how essential medications can sometimes whisper unintended consequences into our intimate lives, is truly empowering. But there's one more common type of medication, often sitting innocently on the nightstand or taken before a big meal, that deserves our attention to complete the picture. Histamine, 2 receptor blockers, H2 blockers, specifically one very familiar name, cimetidine, Tagamet HB. Now, acid reflux, heartburn, that uncomfortable burning sensation, it's incredibly common, especially as we get older. And many folks reach for cimetidine because it's readily available over the counter. It's been around for decades, and it often works well for occasional relief. It blocks histamine receptors in the stomach, reducing acid production. Simple enough. But here's the hidden wrinkle, the part rarely mentioned on the bottle. Those same histamine receptors aren't just in your stomach. They're also involved in regulating hormone levels, including testosterone. Cimetidine has a unique property among the H2 blockers. It can act as a weak antiandrogen. In simpler terms, it can interfere with how your body uses testosterone. It can bind to testosterone receptors, potentially blocking testosterone's normal actions, and it can slightly increase the conversion of testosterone into estrogen. For men taking it frequently or at higher doses, this can lead to decreased libido, that familiar spark of desire might noticeably fade. Erectile dysfunction, difficulty achieving or maintaining erections can become more common. Breast tenderness or swelling, gynecomastia, a more visible side effect caused by the hormonal shift. General fatigue and reduced muscle mass. Testosterone plays a role in energy and maintaining strength. Now, let's be clear. This is primarily associated with cimetidine, Tagamet, and generally only with regular, long-term, or high-dose use. Occasional use for heartburn is unlikely to cause significant problems. But if you find yourself popping Tagamet HB several times a week or relying on it constantly, and you've noticed a dip in your sexual vitality or other changes, it's definitely worth considering. The good news? This one has perhaps the easiest solution of all. You have excellent, effective alternatives for managing heartburn and acid reflux that don't carry this hormonal side effect risk. Switch to other H2 blockers, famotidine, Pepcid AC or Pepcid, and ranitidine, Zantac, though note, some formulations were recalled previously. Check current availability and discuss with your doctor. Work just as well as cimetidine for reducing stomach acid, but do not have the antiandrogen effect. Switching to famotidine or ranitidine is usually the simplest and most effective step. Consider proton pump inhibitors, PPIs, for more frequent or severe heartburn. Medications like omeprazole, Prilosec OTC, esomeprazole Nexium, lansoprazole, Prevacid, or pantoprazole, Protonix, are often more powerful. While they have their own considerations for long-term use, discuss with your doctor. They generally do not interfere with testosterone or sexual function in the way cimetidine can. Lifestyle modifications. Never underestimate the power of eating smaller meals, avoiding trigger foods, spicy, fatty, acidic, caffeine, alcohol, not eating close to bedtime, elevating the head of your bed, and weight management. These changes can significantly reduce the need for medication. I remember patient Henry, a spry 70-year-old, who loved his weekly poker game and spicy chili. He'd been taking Tagamet almost nightly for years for heartburn. He came in feeling sluggish and frustrated because his interest in intimacy had dwindled, and he was developing some breast tenderness, which really embarrassed him. We talked about his heartburn habits. I suggested he try switching to Pepcid famotidine and really focus on avoiding late-night snacks and spicy dinners before poker night. Within a couple of months, Henry was back. The tenderness was resolving, his energy was better, and with a wink, he mentioned things were back on track at home. Such a simple switch made a profound difference. Henry's story reminds us that sometimes the solution is surprisingly straightforward. If you're regularly using Tagamet, cimetidine, and notice changes in your desire, erections, or other signs like breast tenderness, don't just brush it off. Try switching to Pepcid famotidine or Zantac, ranitidine, if available and appropriate. They're right there on the same shelf. And talk to your doctor about managing your reflux holistically. You can keep enjoying life's flavors without sacrificing your vitality. So, friends, we've uncovered the 4 common medication categories that can silently influence your sexual wellness after 60. Mood medications, SSRIs/SNRIs, potential impact on desire, arousal, and orgasm. Alpha blockers, for BP/prostate, potential impact on erections and ejaculation. Beta blockers, for heart, potential impact on desire, erections, and ejaculation. Cimetidine, Tagamet, for heartburn, potential impact on testosterone, leading to decreased desire, ED, and other changes. But here's the most important message, the one I hope you carry with you. Knowledge is your greatest ally, and conversation is your most powerful tool. This isn't about living in fear of your medications. It's about understanding that your body is a complex, interconnected system. What helps one part might sometimes nudge another. The key is awareness. If you've noticed a change in your intimate life, a fading desire, new difficulties with erections, less satisfying orgasms, and you take any of these common medications, please, don't assume it's just age. It might be, but it very well might be a side effect whispering its presence. And side effects mean there are often choices, adjustments, alternatives. Your next step is simple, yet profound. Schedule a conversation with your doctor. Go prepared. Take this list, or just remember the types: mood meds, alpha blockers, beta blockers, or Tagamet. Say something like, "Doctor, I appreciate how this medication helps my mention the condition, e.g., blood pressure, depression, heartburn, but I've noticed since starting it/taking it regularly, I'm having more trouble with be specific, e.g., low desire, getting/maintaining an erection, less satisfying orgasms. I understand some medications can affect this. Are there alternatives within this class? Different types of medication for my condition, or adjustments we could try that might have less impact in this area? I want to manage my health effectively, but this aspect of my life and relationships is also really important to my overall well-being." Frame it as a partnership. You're informing them about an important aspect of your quality of life, so together you can find the best solution for the whole you. Most doctors welcome this information. It helps them treat you better. They might not bring it up first, not because they don't care, but because they're focused on the primary condition or assume you might be uncomfortable discussing it. You starting the conversation opens the door. Remember Walter switching his blood pressure med? Frank finding vitality with a different beta blocker? Henry simply changing his heartburn pill? These aren't rare miracles. They're examples of the power of asking a question and exploring options. You deserve to feel vibrant, connected, and fully alive in every aspect of your life, including intimacy, well into your 60s, 70s, 80s, and beyond. Don't let silent side effects dim your spark when solutions are often within reach. I'd love to hear from you. Has this conversation sparked a thought? Have you experienced something similar and found a solution by talking to your doctor? Share your experiences, your questions, or even just a word of encouragement for others in the comments below. Let's build a community of support and shared wisdom. Your story might be exactly what someone else needs to hear. If this video resonated with you, if it offered a glimmer of hope or a new perspective, please give it a thumbs up. It helps others find this important information. And consider subscribing to this channel. We're dedicated to bringing you straightforward, compassionate, and empowering health information to help you live your very best life in your golden years. Because these years, they hold so much beauty, connection, and joy. Let's make sure you have the vitality and confidence to embrace every moment. Here's to your health, your happiness, and a life lived fully in every way. Take good care, my friends. Until next time.